How much has COVID-19 impacted racialized communities? It's a question that has been examined by the Wellesley Institute in partnership with Ontario Health. The new report has found some striking findings surrounding how systemic racism has contributed to racialized communities contracting and dying from COVID-19 at a rate about 5 times higher than the white population.
And we found that racialized populations were much more likely to get COVID and to have negative impacts from COVID than the white population in Ontario.
The report by the Wellesley Institute examined all COVID-19 cases along with race-based data collected between June 26, 2020 and April 21, 2021 across the province.
If you look at the Latino, Middle Eastern, Southeast Asian, South Asian, and Black populations, they were 5 to 7 times more likely to get COVID than the white population.
That is just one of the jarring statistics found in the report. It also discovered that when compared to white Ontarians, racialized groups had a 9 times higher rate of hospitalization, 10 times higher rate of COVID-19 related critical illness, and 7.6 times higher rate of death.
That means we need a public health strategy that reaches everybody. And to do that, we need data that shows us who's being protected and who isn't.
Among racialized groups, those significantly impacted by COVID-19 included Middle Eastern people with 5.4 times more likely to contract the virus, South Asians at 6.7, and Latinos at 7 times more likely to be infected when compared to white Ontarians. Dr. Kwame McKenzie says a lot of that has to do with pre-existing health conditions among these populations, along with socioeconomic factors, but there's more.
Some of that is because our public health response was generally a one-size-fits-all response that didn't reach racialized populations properly and didn't meet their needs.
While these numbers are high, Dr. McKenzie says it is an underestimate, with only 2/3 of the population that disclosed their race.
What we found was even if you tried to make up for the data that we didn't have, the racialized population was still much, much more likely to get COVID and to have negative impacts from COVID.
Not included in the report, Ontario's Indigenous population. Dr. McKenzie says the province went through a separate process to retrieve that data, not included in these findings.
It doesn't mean that we think that Indigenous populations don't have big disparities in COVID. We think they do.
The report also suggests several recommendations, including a standardized collection of race-based data, that the healthcare system apply an anti-racist approach, and that the health system use race-based data to inform recovery efforts and address structural inequities. Melissa Nakavali, City News.